Once returning home, if you experience any of the following signs or symptoms, call your orthopedic surgeon's office or total joint nurse navigator immediately. The wound area looks red or feels hot. There's foul smelling or yellow-green drainage from the incision site. Pain increases in the joint area. You develop a temperature of over 101 degrees Fahrenheit. You experience calf or groin pain, tenderness, or swelling. You experience shortness of breath or chest pain. You experience bleeding. You have difficulty urinating. Bleeding that does not stop, such as nosebleeds, dark brown urine, red or black streaks in stools, unusual pain or swelling, throwing up blood or traces of blood and vomit, unexplained headache, dizziness, or weakness, bleeding from shaving or minor cuts that do not stop bleeding, unusual bleeding of the gums when brushing your teeth, more bleeding than usual during menstrual cycles, or unexpected bleeding. Prior to going to the emergency room, please contact your doctor first with concerns. However, if you feel you are experiencing life-threatening symptoms, call 911 immediately. After receiving a total joint replacement, you will be required to take an antibiotic treatment for infection prevention before other medical or dental procedures. If you have had a joint replacement surgery in the past, you may have been told you will now need antibiotics before any other surgery or even before dental cleanings. Surgeries and dental cleanings can introduce bacteria into the body, which could travel to the new joint and cause infection. This includes routine procedures such as colonoscopies and biopsies. It is important that you allow all your healthcare providers to know that you have had a joint surgery in case you have other medical conditions that would create a higher risk for infection. The success of your new joint depends on it. We hope you found this video helpful. If you have any questions or need more information, please contact your total joint nurse navigator.